Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. Hey, I wanted to share this information. This is basically a press release or service announcement, what have you, from the VA regarding access options for veterans for healthcare services. I wanted to share this with you, so please hit the thumbs up, subscribe, share with a friend, all that good stuff. I really appreciate it. It helps to get the word out if you do two things. Hit that thumbs up and let the video run, because it puts this into the hands of those that truly need it. So even if it's not you, it could be somebody else who needs it, and by watching the video or letting it run allows YouTube to know that they should push it on to more vets. All right, so with that, let's jump into it. VA offers rural veterans options to connect with providers. 20% of veterans in rural areas do not have access to the internet at home. So wanted to go through that and give you some tips and tricks, some things that the VA can do to help with that. There are more than 4 million veterans in the United States who live in rural areas. Rural communities face unique healthcare challenges, such as fewer healthcare options and longer travel times to visit medical centers. VA is working to expand access to care in rural communities through telehealth and other virtual means. VA telehealth is a convenient care option that allows veterans to connect with their VA providers from anywhere. If you or a veteran you know would benefit from VA virtual care, it says to keep reading, and here's some options to consider. So let's jump into it. Do you need internet access? Well, that's an important one. Request a digital divide consult. Now, you might not, but maybe you know somebody who does. Maybe you have a family member who does not have internet access. And if you don't know anybody, letting this video run helps to put in the hands of somebody else who may know somebody who does. So let's jump back into it here. According to the Office of Rural Health, 20% of veterans in rural areas do not access the internet at home. VA is working to close this digital divide, the gap between people who do and do not have access to the internet and internet-connected devices such as smartphones, tablets, and computers. For veterans who want to use the VA telehealth but do not have access to internet service or internet-connected devices, such their VA care team can refer them to a social worker who will assist the veteran with their internet and technology options. The Digital Divide Consult is a process that connects veterans who don't have internet access or a video-capable device with programs and resources that may be able to provide the internet service or technology needed for video visits. More than 140,000 veterans across the country have gone through the consultation process to date. Once a veteran can get online, they can have video telehealth appointments from home. This reduces the time and expense of traveling to VA facilities, an important benefit for veterans in rural parts of the country. If you're interested in the digital divide and getting a consult, talk with your VA provider. Learn about clinical resource hubs. All 18 of VA's Veteran Integrated Services networks have clinical research or resource hubs that offer a combination of in-person care and telehealth services. When local VA facilities have gaps in service capabilities, clinical resource hubs can offer veterans a full range of VA services. Use VA Video Connect with fewer worries about cellular data fees. Through VA Video Connect, the video conferencing app, veterans can have secure video visits with their VA care team using the internet-capable device. AT&T, SafeLink, and TracFone, T-Mobile, and Verizon help veteran subscribers avoid data charges when using VA Video Connect on their networks. This enables veterans to connect with their VA care team with fewer worries about data fees. For more information, you can visit the mobile carrier program webpage. Find an Atlas location near you. If a veteran doesn't have in-home internet access or doesn't wish to have video appointments from home, they can see if there is an Atlas accessing telehealth through local area stations. Site in their area. So ATLAS is the acronym, accessing telehealth through local area stations. So Sounds like an area that you would be able to go to, kind of like a library, right? You go to a library and you can look at a book. So you would go to an area and you would have your video conference. So let's see what they're saying here. Atlas sites offer veterans comfortable private spaces equipped with internet access and technology needed to meet with VA providers through VA Video Connect. Sites must be associated with the VA Medical Center where the veteran is enrolled in care. Atlas sites are located in select American Legion and Veterans of Foreign Wars posts, Walmart stores, and more. Interesting. Check out My Healthy Vet and VA apps. Veterans can use My Healthy Vet, VA's online patient portal, to manage their care from home. They can use it to request their VA prescription refills. Pretty convenient. After you do it a few times. The first time, you're kind of stumbling around, but once you do it, you get more comfortable. Review their VA medical records, manage their VA appointments, and connect with their VA providers directly through secure messaging. Veterans can also take advantage veterans can also take charge of their health care with tools on the VA App Store. VA apps are designed to help veterans with sleep issues, weight management, tobacco, I can't say it. CESSATION, cessation, the effects of military sexual trauma, anger management, and more. VA provides a variety of ways for veterans to act. At least it's toward the end, and maybe a lot of you dropped off. All right, so VA provides a variety of ways that veterans can access high-quality care remotely. If you or a veteran you know would benefit from virtual care options, contact your VA care team or visit the Office of Connected Care website. The Office of Connected Care website. I just clicked on the link to see if it... Yeah, there it goes. So the website is Connected Care, Connected, CONNECTED, care, CARE.va.gov, connectedcare.va.gov. And it says expanding veteran access to care through virtual technologies. You have a spot for veterans and you have a spot for healthcare professionals. What's new? VA news, connected care programs. Let's see, the Office of Connected Care brings VA digital technology to veterans and healthcare professionals, extending access to care beyond the traditional office visit. Through virtual technology, VA is able to deliver care to patients where and when they need it. All right, so again, that is connectedcare.va.gov to get more information on that. So, hey, thanks for watching. I appreciate you. Have a great one. And remember, if we don't take care of each other, something went wrong.